that I'm going to invite anyone who is new to this group. If you want to introduce yourselves first, and then we'll get into the minutes approval. Nobody? All right. So you should have received a copy of your minutes that Amelia sent yesterday from the August 27th meeting and had a chance to review them. Are there any corrections or additions to the minutes? Do I have a motion to approve?
I move to approve.
And second?
Second.
Okay, it's been properly moved and seconded to approve the minutes from the August 27th meeting. All in favor?
Aye.
Those opposed? Motion carried. All right, Amelia, it's up to you now.
Thanks, Lisa.
You're welcome.
All right, afternoon, everyone. Thanks everyone who's able to join today. We're gonna try to keep the agenda into two parts and make it discussion heavy, so less presentation and more work group discussion. We got through all the administrative stuff. We're gonna start this agenda. We're joined by a representative from the Washington Health Benefit Exchange, and they're gonna give an overview of their consumer decisions support tool and how it helps consumers navigate the different plans, choose different plans, and it ultimately provides tailored recommended plans to consumers should they choose to use it. So we're grateful to be joined by Kristen, who I'll hand it over to in a second. We'll have a discussion from Kristen after her presentation, so there'll be time for questions. And then the rest of the meeting, we will get right back into reviewing the Maryland's Get an Estimate Consumer Decision Support Tool together and kind of taking a deeper dive into the second half of it. So that's the agenda for today. Again, I'll introduce Kristen really quickly. As I mentioned, she's from the Washington Health Benefit Exchange. She's on their policy team. She's here to give a presentation on their consumer decision support tool. So I will go ahead and hand it over to Kristen after the presentation. Again, there'll be time for questions, but Kristen, I have the slides for you, and feel free to take it away.
Great, thank you so much. So I'm Kristen Villa, Senior Policy Analyst with WABI, and we're a state-based marketplace in Washington. And I'm going to share some information about our consumer decision support tool that we've had for a number of years. Next slide, please. So just a level set, here is an overview of what a CDST is. And it sounds like if you all are already working on one, this might be information you're already well familiar with. But at its heart, it's software that helps customers compare and shop for plans by providing them with plan recommendations. And it takes into account key things such as the plan premium, and so factoring in any subsidies a customer is available for, out-of-pocket costs, which are calculated based on how much care the customer thinks they're going to use, and then the plan design, the providers that are in a given plan's network, and finally, how the plans cover prescription drugs that the customer takes. And so for the CDST to work, it needs information from the customer. And although it recommends plans, the customer is still able to all of the plans that are available to them. Next slide. So in Washington, our CDST is called Smart Plan Finder, and it's on our webpage. And it is a separate page. It's a page owned by a vendor Get Insured. And so this was really one of our first steps in curating the market. And so when we procured our CDST in 2017, our goals were really to help a customer find a plan for their health needs and budget. And so some of the functionalities that we were looking for that were really critical is total costs of care. So we wanted to include both premiums and how much a customer is estimated to pay when they receive care. And then also for the tool to let them know if any providers or prescription drugs they wanted covered were indeed covered by a given plan. And we really wanted it to feel like an integrated, seamless part of our platform, Health Plan Finder. And so, as I said, our CDST page is owned by Get Insured, but it integrates with our provider directory, which is a separate vendor called Leap Orbit. And it also integrates with Health Plan Finder. And so it considers both any subsidies a customer is eligible for their premium, and also if they're eligible for cost sharing reductions. And so that's all taken into account with the plan recommendations and calculations. And so 2021 was the first year we made some key updates. And so the first one there was that if a customer logged into their account in Health Plan Finder, we updated it. So the CDST went from being opt-in to opt-out so that more customers would use it. And then the other key change was that we made adjustments to the order we display plans in Health Plan Finder. So a customer would first now see the recommended CDST plans, followed by our standard plans, which we call in Washington the Cascade Care plans. And a couple of years ago, our board gave us direction to further serve as a market steward. And so we're really curating the market in a few different ways. And so one is with our standard plans, and the other is with the CDST. And so thinking about ourselves now as a market steward, that's a perspective we're bringing into our decision making as we are actually in the process of re-procuring our CDST. So we released an RFP just a few weeks ago. And so a new CDST contract will go into place next summer. Next slide. So our CDST asks customers a few questions and then recommends up to 3 plans for them. And it weighs out-of-pocket costs heavily in making a plan recommendation. So this includes both premiums and cost sharing when the customer uses their coverage. And so we have a state premium subsidy, which we call Cascade Care Savings. And so a customer can get this if they enroll in a standard gold or silver plan. And so what we have found is because of the state premium subsidy being tied to the standard plans, those often have lower net premiums and are some of the most recommended plans to customers. And so we also, in our plan display, set it so that our standard plans appear on the screen before non-standard plans to try to encourage customers to enroll in them. Next slide. So every year, we do an open enrollment analysis of our CDST to see things such as usage, what percentage of customers are choosing a recommended plan, and what are the plans the tool is recommending. And so what we found this year is that the top recommended plans are standard plans from those carriers who have the lowest premiums. You'll see we show top recommended plans for all customers. And then in our analysis, we segmented out those customers who are at or below 250% of the federal poverty line. And the reason for that is that they are eligible for our state subsidy. And then they're also eligible for those cost sharing reductions in the silver plans where they'll pay less when they receive care. And so that's why most of the plans you'll see for the 250% and under are those silver standard plans. And so these recommended trends are really a change from before. So before we launched our state subsidy, what we saw was that the tool recommended a lot of non-standard bronze plans much more often because of the weight given to out-of-pocket costs. And those non-standard bronze plans had some of the lowest premiums. And if a customer reported that they expected to not to use very much care, then it worked out such that those non-standard bronze plans had some of the lowest out-of-pocket costs, and they would get recommended frequently. And so on the next slide, we'll go ahead and I'll talk more in detail about the CDST and how it works. And so our CDST is available both for anonymous browsing and also for customers, obviously, who are logged into their account. And so if a customer is doing anonymous browsing, that's the screenshot you're looking at here. And so for anonymous browse, the tool is opt-in, and it appears after the customer enters basic information like their age, their income, and their zip code. And so as I mentioned, if a customer is actually logged into their application, they're taken to the CDST, and then they have to opt out of using it. And so they'll see this after they get their eligibility determination. Next slide. So here's our CDST page, and I'll walk you through those inputs. It's just this one screen. And so first, the customer has the option. They can enter up to 5 providers or facilities. And then they're asked about their medical utilization. And you see they're given a few different options to choose from that best describes their anticipated medical needs. And then the customer has the option to enter up to 5 prescriptions, and then are also asked about their expected pharmacy utilization. Next slide. So the CDST then takes these inputs and it recommends up to 3 plans to a customer, and then it puts that little badge on them that you see there that says Smart Choice. And then you'll see that if a customer entered providers or prescriptions they wanted covered, those appear on the results. And so there's a green check that confirms if they're covered, or a red circle if they're not covered. And the estimated net premium that you see there on the left bottom is the customer's net premium after any federal or state subsidies they're eligible for. And then the plan deductible is also something we feature prominently. And finally, the estimated total yearly cost there on the bottom right includes both a year's worth of net premium and costs from the expected utilization they entered on the CDST page. And so then on the next couple of slides, I'll show you how the health plan recommendations kind of fit in as a larger part of the health plan finder display. So for those customers who use the CDST, the plans recommended as Smart Choices show up first. If they opt out of it, then the plans are ranked in order of premium. However, we have some more nuance there to how the plans are ranked to help promote enrollment in our standard plans. And I'll share more about that on the next slide. So following any CDST recommendations, if the customer used it, the order in which the plans are displayed to the customer is based on their cost sharing reduction or CSR tier. So for those folks who are at or below 250% of the federal poverty line, they first will see those Cascade Standard Silver plans ranked lowest to highest premium, followed by our non-standard Silver plans. And so the goal there is really to help customers maximize any financial assistance they're available to them. So whether it's the tax credit, our state premium subsidy, and those cost sharing reductions to help lower out-of-pocket costs when they seek care. Then we show them the non-standard Silver plans, lowest highest premium, followed by those other non-Silver, non-standard plans. And then the experience for our customers who are over 250% FPL. There isn't any kind of metal level preference in our display order, but there is a preference for our standard plans. So we display those first, lowest to highest premium. All right, next slide. And now we just want to break down how the CDST algorithm works to score plans and how it arrives at those plan recommendations. So it assigns each plan available to the customer and the county a score. And so it's those top 3 scoring plans that are recommended as Smart Choices to the customer. And the majority of the plan score comes from that total expense estimate score. And so the way the points are distributed between those different inputs you see, it depends on what the customer enters. So if they don't enter any providers or prescriptions, the algorithm adjusts to account for that. And so here is how that expense estimate is calculated. So we, the exchange, we provide the CDST vendor with those plan and benefits templates and also rates that our carriers file with the Department of Insurance. So what the tool does is it takes these benefit designs the carriers filed and it marries them up with a utilization profile. So if you recall on the screen, the customer answers questions about their expected medical and pharmacy utilization. And so each of the options for utilization is connected to a utilization profile. And so what this is it's a package of services and base costs. And so that utilization profile is then fed into each plan design to come up with an estimate of how much each customer's healthcare will cost. And so this is then added to that year's worth of net premiums for the customer. And so that's how we get to that total expense estimate. And also some of the other things that are available points is if the customer enters specific providers or prescriptions, if a plan covers them, the plan gets more points from this. And we also were giving the vendor each carrier's formulary filing. So that's how they know if a prescription drug is covered or not. And then if you recall, we have a separate provider directory vendor, Leap Orbit. And so the tool is getting results from Leap Orbit on if a provider or a hospital is covered. And so if you think about it, for a low utilizer, most of that score is going to be based on the premium because costs for getting care are going to be very little of that total annual expense. Whereas the score will be much more about a plan design for a higher utilizer. And so our standard plans have more of an advantage in recommendations when it comes to premiums because the state subsidy is tied to silver and gold plan premiums. And then with plan design, there's not an explicit favoring there of standard plans profiles. They have a fixed set of services attached to them. And then it really depends plan by plan about how they cover different benefits, such as ER or primary care. And as this group, I'm sure well knows, each plan has to make decisions about how to cover different benefit categories because we're all trying to stay within the AV range for a metal level. Okay, and finally, on the next slide, we'll just take a look at just some usage trends. And so to orient you, the graph on the right, this is counts of people who came in during our last open enrollment and ultimately selected a plan. So this is just for that November to mid-January time period. So it doesn't include if someone used the tool through anonymous browse, and also customers who may have made an account but ultimately didn't enroll in coverage. And so at the end of our last open enrollment, we had over 270,000 customers enroll in a QHP. So that means about 45% of them used the tool. And so this graph shows a unique count of customers because customers can come in and use the tool as many times as they would like and change their inputs. So we are only counting each person once. And then the count also reflects the shopping impact on a family. So like if I as a parent went and used the CDST and enrolled myself and my child in a plan, we would be counted as 2 on the graph. And so we have seen the tool usage go up each year, just as our enrollment has. Some other key things, most of our enrollees using the tool are returning customers. And we see that overall, 48% of those customers using the tool enrolled in a smart choice. So they picked one of the recommended plans. And we have definitely seen a difference in usage and selecting a recommended plan among our new versus our returning customers. So I'm sure it's not surprising that new customers are more likely to use the tool and more likely to select a smart choice because they're coming in and picking a plan for the first time. And we also know that a lot of our customers who are renewing, they don't take any action during open enrollment and they're just auto renewing. So not surprising there. All right, I know that's a lot of information, so I'll go ahead and pause now for any questions.
This is Lisa. I have a question. You were mentioning about the provider network, that it's run by Orbit. Is that correct? Is that
Yes.
so how frequently is that updated to make sure that the providers are currently taking the plans that are on the marketplace?
Yeah, so monthly at least.
Okay. And then I have one more question about prescription coverage.
Yes.
So you were saying that someone could put in like 5 different prescriptions. In order to, or in putting those prescriptions in, then would it tell you, okay, this is a brand name prescription and it's depending on which plan, it would tell you what the deductible or what the monthly copay on that item would be?
Yeah, so it does. We do label if you enter a drug, whether it's a brand name or generic drug. We don't list the specific cost sharing for that drug. And the CDST, it doesn't calculate, so its out-of-pocket cost estimate doesn't calculate drug costs based on a specific plan, if that makes sense. So it's not adjusting for that.
Okay.
Yeah.
Thank you.
Yeah.
Okay, so I have a question. Kristen, thank you very much for that presentation. Like you said, it's a lot of information. So I think that there were things that were flashing in my brain while you were talking, and I go, "Oh my gosh, how does somebody know that they could go into CDST or not? I mean, just in terms of access to the tool, how do people know that they can go to CDST? Because I'm going here to Google and I can't find you."
Got it. Yeah. So if you're going through anonymous browse, if you're going to go shop for a plan, we start you out on a screen just to find out your age, if you use tobacco, if you're pregnant or not, and an estimate of your income. And then there's a little pop-up where we ask, do you want help shopping for a plan? And so if you click yes, then it takes you to the CDST page. And then if you're actually logged into your account, then so after you put in all of your information and you get an eligibility determination, like if you're eligible for tax credits or our state subsidy, then you're automatically taken to the CDST and you have to choose to opt out of it.
Okay, so what was my front door? How did I get in? Did I go to dc.gov health?
Oh, sorry. To clarify, we're Washington State, so West Coast.
Oh, Washington State.
Yeah.
Okay, so I'm trying to find you in Washington, D.C. Sorry. Okay, so if I'm in Washington State, do I go to Washington State Health, or is there a Googling thing that I can do? I say, oh, I want healthcare. I'm in Washington State. I want healthcare. And how do I do that?
Yeah. So we're Washington Health Plan Finder.
Okay.
Yeah.
All right. Thank you.
Welcome. And I saw Steve had a question.
Yeah, question on the data being shown. Is this specifically consumers D2C, or is there possible that there's broker data in here as well as navigators? What makes up this data?
Great question. So this is customers who ultimately enrolled in a plan. And so we can see so the data set that we pulled, we can see if that customer was paired with an account worker, a broker, or navigator. That's one of the columns we have.
Okay, so this is like an overall cumulative of like everyone?
Right. Yeah. So this is everyone who came in during open enrollment, used the tool, and ultimately enrolled in a plan. So for example, if you were anonymous browsing with your navigator or your broker, you wouldn't be counted in this graph.
Got it. Thank you.
Yeah. I see another hand.
Shwano, go ahead.
Hi, Christian. You just mentioned that you have a question regarding one's health and if they smoke. Is that relevant in terms of which plan they select, or is it just kind of a formal question?
Yeah. So that's a question we ask everyone, regardless of whether or not they use the CDST, because all except for one of our carriers has a separate set of premiums for tobacco users.
So that's the essential only, meaning anyone with pre-existing conditions or with any other medical issues would be able to qualify for the, I guess, the lowest rates, but specifically smokers would have to pay an increased rate.
Right. And that's like something that's allowed under the ACA, is allowing to rate for tobacco usage. Yeah. So that's not something specific to us or to the tool.
Got it. Okay.
Yeah.
I thought someone else had a hand raised. Sorry if I missed it. I have a question, but I'll hold for a couple seconds. Okay. Kristen, I have a question about any feedback that you guys have been able to collect from consumers on the use of this tool, and specifically if you have any consumer feedback for consumers that did end up choosing a smart choice plan and their level of satisfaction with the plan, any information around that?
Yeah, I would say the biggest points of feedback that we have heard over the years is challenges with the provider directory. So, and this is an industry-wide problem about provider directories not being up to date. And then also, in some cases, you could see 5 listings, for the same provider with slightly different addresses, right? With like a suite number entered and one not. And so the CDST is just returning the same results as the provider directory. And so in some cases, those results are not accurate for those reasons I mentioned. And so the biggest point of contention, I think, for a lot of folks is that it recommended a plan to them that said their provider or hospital was covered and it wasn't. And that's less to do with the CDST than like just overall challenges with provider directories and accuracy. However, it reflects upon the CDST, right? Because like a customer going through this process doesn't know, the ins and outs of what different vendors are involved. It's just that the CDST had wrong information. So I would say that's the biggest challenge.
Yeah, we're familiar with that challenge too. Do you have disclaimers or anything within your tool that reminds consumers to check with a plan or anything like that? How do you have any questions on that?
We do have stuff that it's like, provider directories are changing all the time. Like, please contact your provider to verify. But sometimes even when a customer calls a provider, they don't necessarily even know, right? Like there are so many different insurance companies and insurance plans with network nuances. So it can be a challenge, needless to say.
Thank you.
The other thing I would say on the feedback is we do ask customers, so, they can enter their provider. And the other thing we've heard is that the tool, since whether or not a provider is covered is only a small part of the score, customers will sometimes get recommended a plan that doesn't include their provider or hospital. And there's no explanation for that. So it almost kind of feels like to the customer, you asked me for this information and I gave it to you, and then you recommended a plan to me that doesn't include that, and there's no acknowledgement of that, right? Something like, well, we recognize this doctor is not in this plan, but here's why you might want to consider it. So that is the other thing, is when they're recommended a plan where the provider isn't included and it's not addressed in the results, any kind of an explanation.
So a lot of feedback on the provider directory and
Yes.
clarification around how plans
Yes.
are chosen, what providers are listed, and yeah. Thank you. Other questions from work group members or MHB staff on the call?
Hi, this is Joan Painter, and I have a question. And I picked up a few minutes late, so forgive me if it's been covered. I was curious if the selection tool also includes hospital affiliation.
No, not specifically. So you can look up to see if a given hospital is covered, but like you can't, are you asking if you can search for just a specific hospital system overall?
Okay, thank you.
Okay.
And to clarify, Kristen, you said that your tool can search for hospital systems or certain.
It can search for a specific hospital, right? So like you can put in, University of Washington Medical Center, but if you just want to search for a whole system, you can't do that. But if you want to search for a specific hospital location, you can.
I have a closing question, unless there's any other questions from any members, any MHB staff. Last call. All right, hearing none. Last closing question. I'm curious if, based on your experience in the last couple of years with your support tool and with the Smart Choice plans, as Maryland's considering doing this, do you have any best practices that you would recommend as we're thinking this through, or just kind of any overarching considerations?
Yeah, definitely. Some things I would say like to keep in mind are think about different types of customers and what would be the best plan for them to be in. And so having a tool that will support that. So like I talked about before we had our state subsidy, we had folks who were lower income, low utilizers who were getting recommended a bronze plan. And so thinking about like in that situation, we would really want, especially if the customer is 200% or below FPL, that's a customer we would really want in one of those silver cost sharing reduction plans. And so you wouldn't want the tool to be like undermining, the structure set up in the ACA to make plans more affordable for low income folks. So kind of think about that, like, if you're going out to bid and things like that, what different customers need and kind of how subsidies are structured. The other thing I would say is just transparency with the customer, just explaining to them why they were recommended the plan they were recommended, I think is really important. The other thing too is thinking about our tool currently allows 5 providers and 5 prescriptions to be entered. But that's not enough for a customer who has a lot of complex health conditions. So just think about, people will need different levels of care, right? And so to make sure that they don't have to go through the tool 3 times and get 3 different sets of recommendations, that's something that I would consider too.
That makes sense. Thanks. That's helpful to think through. And I guess a quick follow-up question, is there a reason that for the prescription input, it's limited to 5?
That's a great question. The tool was procured before my time, and so as I understand it, we just purchased the vendor's base product and we didn't do any customization to it. And so that's another key thing to consider too, about like, there are pros and cons to taking an off-the-shelf product from a vendor versus doing customizations. And so that's something to consider too, about like, are you looking for something that's highly customized? Are you looking for something that's off the shelf, or maybe something in the middle?
Wouldn't 5 give a pretty good idea, at least to describe if someone's like a bronze or silver or a gold? Like, it kind of gives a good idea. If someone's taking that many medications, would probably, lean towards a gold plan more than a bronze plan. So it kind of does that.
Yeah.
And is that something that works within the tool's calculation? Like, if someone puts in, to Shlomo's question, they have 3 monthly prescriptions, but maybe on another question they say low healthcare utilization, or they prefer lower premiums, how would that factor in with the choice hierarchy for how smart choice plans are picked?
Yeah. So there is like a utilization profile for both the medical usage and the prescription drugs. And I'm not sure like all of the the behind the scenes calculations of how it's like reconciling those 2 different things, but it's taking them both into account. And it doesn't have any kind of a metal level preference. It's just looking at like what the total cost would be. And speaking of which, risk tolerance, that is the other big one that I forgot. Is also consider having a tool that takes into account risk tolerance or risk preference. I think that's really important to try to get at in some way. Would the consumer prefer to pay lower premiums but deal with a risk that they might have a lot of out-of-pocket costs, or would they prefer to pay a larger premium and have lower out-of-pocket costs? And then also really like using the tool as a way to educate customers, especially on that trade-off in terms of, yes, you can pay a low premium, but what that might mean if you have a major medical event is you have an $8,000 deductible. And so to try to get at that and explain that to them so that they're fully informed with what they're purchasing.
That's a great point and definitely good consideration. Thanks that was really helpful feedback. Lots of food for thought, and really appreciate you presenting on where you guys are in your consumer decision support tool. We're kind of looking to you as an example of considerations moving forward. So just really appreciate your time today. I will move on to the next agenda item. If anyone does have questions for Washington or for Kristen afterwards, you can always email the group and I can do follow-up. But otherwise, Kristen, thanks so much again. Just really appreciated having you today and for you taking the time out.
Yeah, thanks so much for having me. All right, thanks all. Have a good day.
Thank you.
All right, so continuing right along, we can go ahead and we got about 30 minutes or so left in the meeting, and we're gonna just jump straight into navigating to our consumer decision support tool, our Get an Estimate tool on the Maryland Health Connection webpage, and picking up where we left off at the last meeting 3 weeks ago. So for this discussion, we're gonna kind of move from those initial consumer input pages and start talking about the actual plan shopping page and the plan tile displays, which includes the sorting and filtering options. So getting into that second half of the tool where consumers are actually going through plans and starting to compare and consider their options. I do want to revisit, picking up from the August 27th discussion, we had just the briefest conversation about the estimate of financial assistance page and whether or not that information is clear to consumers, whether we're explaining the types of financial assistance available clearly And I think there was a comment specifically about how we explained the tax credit. So we'll take maybe 5 minutes to look at that page too, since there was some comments that we weren't able to fully follow up on from the last meeting. And before getting in quickly, just wanted to give an overview based on what we've pulled out from the prior work group discussions, some kind of major themes of what you as members have highlighted would be of interest to talk about that are specific to kind of the second part of our plan tool. So some of the major themes are discussing more the ways to simplify the plan tile when we're displaying all the individual plan information, and ensuring that we are providing an appropriate amount of information, that it is easy to understand, and that it's presented in a consumer-friendly way. There's been discussion about the importance and kind of best practice of using symbols over just using numbers in pricing. So maybe considering how we can incorporate more of those best practices into our plan information displays, improving how we communicate about the value of silver cost sharing reduction plans for consumers that are eligible for them when they get to the plan shopping page and when they're considering and comparing plans. In particular, kind of choosing those higher value plans that you're eligible for over bronze plans for eligible consumers. And then thinking through, picking up from what we kind of just learned from Washington with their plan recommendations, also considering smart default settings where we're kind of auto sorting or filtering plan options based on consumer input so that they're organized in a way where more kind of tailored plans are listed first that might be a better fit for a consumer. So just kind of thinking through how we're displaying plans in the plan order. So I'll stop sharing my slides and we'll kind of get right into the discussion. I will note too that I have pulled some state examples of what other states do with their plan tile display, with their sort and filter options. And they're in slides subsequent to this one. I'm happy to go through them with the group if we have time, but I think it would be more beneficial to jump into the discussion first, and then we'll see if we can go through those state examples together if we have time. If not, I'll share the slides after this, so they'll be available to everybody. With that, I will stop presenting these and we'll get the Maryland Health Connection homepage up. All right, can everyone see the screen? Great. So to get started, we've discussed this page in quite a bit of detail in the last couple of meetings. So, remember we have all these initial consumer questions that they have to input. We've had some discussions about who to include and how we're displaying this information about who to list in your application or when you're looking for an estimate for your plan prices. We've talked a little bit about the notice about what income to include when you're entering your annual household income. We can always go back to these things in a later meeting. We have a couple more left. So if there is more discussion around any of those items, please let me know and we can kind of focus on them maybe in the next meeting or the meeting after. So quickly before we get to the plan shopping page, there were definitely a couple of comments about this financial assistance page. So once a consumer puts in all their information, they're taken to this page that estimates whether they qualify for cost sharing reductions, the federal premium tax credit, as well as our additional Maryland state subsidy, which is our young adult subsidy. And that's listed in that last item, the state premium assistance. So wanted to open it up here if maybe some of the individuals who had raised kind of some concerns about this page or had some thoughts about making some of these explanations a little bit more understandable. I know there was some discussion about the premium tax credit and whether this explanation was understandable to the consumer, presented the information, just like gave a clear explanation of what tax credits are. So opening it up for some initial input if you want to get started on the discussion here. Allison, yes.
Hi, Amelia. Yeah, Allison from Kaiser Permanente. I think just looking at the language used in this page, it's all kind of wonky policy terminology that, of course, we all in this call understand, but the average consumer wouldn't. So cost sharing reductions, premium tax credit, that just doesn't mean much to the average consumer versus, you could say something like reduced co-pays and deductibles or financial help for premium tax credit or a reduction in your monthly premium, something that's more plain language. I'm sure, others can come up with better suggestions, but I think that would be my feedback for improving this page for consumer understanding.
Thanks. Yeah, so just to reiterate, recommendations maybe for more plain language, less policy heavy, that are giving that more kind of policy oriented description of what these types of financial assistance are. So, just generally making it more consumer friendly.
So, so some of those things you can't really, I don't know how you're going to make it consumer friendly to say federal tax credits promote, but maybe you can do something that has the easier explain and has a button to get more details. I don't know, something like that.
I was gonna note that we have the hover overs for each of these, which I think, Carmen, that's what you're getting at.
Yeah,
and
right. Yeah.
Yeah, and they provide. I don't know if it's, we could have discussion of if these hover overs are a little more consumer friendly and if we should make some of this information more prominent on this page versus having to hover over it. But they do provide a little more of an explanation of what the tax credits are and what, cost sharing is and the state premium assistance.
Yeah, that's excellent. That's good.
Okay. So are there any thoughts on, I'm hovering over the premium tax credit explanation. Is there information in this hover over? I'm not sure if people can read this or not. If not, I can read it out loud. But is there more consumer friendly information in this hover over that we could consider changing? Or to Allison's point, should we maybe, not be using the policy terms like tax credit and just focusing on, what does it do? It reduces your premium. Just being more kind of not basic, but simpler in our explanation. That's not necessarily using the policy terms.
Right. I mean, I think I would have to sit and stare at it for a while to come up with a simpler form. So because even the hover over, if you start reading at it, where it says a premium tax credit is a tax credit that may be used to reduce the cost of your health plan premiums. That's good. But how do I do that? It can be used up front at the time you buy your insurance. So it still needs to be simplified, right? So, but I like the fact that we have these hover overs, maybe flip them. I don't know. I'd have to stare at it for a while. I don't know if anybody else is quicker able to state what it should say, but we'd have to, can we just send that in to you later on or something?
Yeah, that's, I it can maybe coordinate some more tangible follow-up if
so
worker members want to take some time and think about it and provide some options for different, more kind of health literacy friendly ways of displaying this information. And we can also come back at the next meeting and give some of our examples of here are some different ways we could.
Sure. And when you give us these slides, will we see the hover overs or we won't see the hover overs, right?
No, and right, because I'm just sharing my screen right now. So you'd have to go through the Get an Estimate tool yourself and just kind of play around with it. So I'll make sure I'll keep resharing the Get an Estimate link so it's easy to access. But yeah, it's something always encouraging everyone here to play around with it in their free time and kind of pick out, different things that they're seeing that we're maybe not going over.
Okay, thank you.
Thanks, Carmen. Steve, you have your hand raised?
Yeah, curious if you run any Adobe Target or A/B test on your site just to see like what folks interact with. Like for example, like the premium tax credit. have you ever tested premium tax subsidy? Like, is there a reason why you chose credit versus subsidy, and like any data behind that?
That's a good question. I don't know if anyone from the exchange on the call can speak to that more. I'm not sure why that language was chosen other than, we're just pulling what it is, which it's the tax credit versus saying subsidy. And I think, my guess would be we're trying to differentiate between just a subsidy where, that plays differently than a tax credit where you are liable during your tax filing, and versus a subsidy that's generally given without the potential for having to return at a later time. But we can kind of think through the language and why we chose it and if there's better language to use. Allison, go ahead.
Yeah, I think that's exactly right, Amelia. There is a clear difference between tax credit versus subsidy. And I think, the term tax credit, again, maybe not widely understood, but we certainly have to be transparent about what it means. So maybe, the initial name of it, where it says premium tax credit, could be simplified, but, in the hover text, we somehow have to explain that enrollees will reconcile, the amount they are eligible for at the time of taxes. And, we don't get into all those details with the hover text, but we do have to use the term tax credit at some point.
Yeah, that's a great point. And I'll note that in my follow-up after today's meeting. We'll ask for some more formal feedback from members after you guys have a chance to look at this in your own time, give it some more thought, but keeping in mind too the way that we describe particularly the premium tax credit, there are tax implications come tax time. If your income is not correctly listed, there's a lot of implications around the tax credit. So we have to be mindful of that and make sure that we're translating that information to consumers in the best way we can and in the right format. So maybe, depending on there's going to be more information in our application about the importance of inputting your correct income as it relates to tax credits. So we'll keep that in consideration.
So in the enrollment form, you guys have information, because it is confusing, right? Based on the data that you enter this fall, you're not going to have tax implications until April of 2026, right? So it's just, you're making these decisions way ahead of advance, and you won't see the impacts until a year plus later.
Yeah, and it's, outside of the scope of this work group, but we also consider, how we're making sure we're keeping that messaging up for consumers so that they understand, you have to change your income throughout the year. If your income changes, you have to update your MHC application, which would update your tax credits accordingly. So lot of considerations with this, and especially if this is just sort of the initial plan shopping tool before you actually get to the application, how much information do we want to display about the tax credit in this section versus what would be then in the application. Karen?
Yeah, not to beat the dead horse of the tax credit, but for the pop-up here, it looks like just a lot of information to me all at once. And how is a consumer supposed to know? So you can use it up front, but maybe you don't want to use it up front, or you could split it and use some up front and some later. But all they want to do right now is look at the healthcare plans. So I wonder if it would make more sense to just say the first sentence and then link to a page where this is described in more detail. Just they're not getting all overwhelmed up front with all these extra choices that they hadn't even thought about. That's my thought.
No, thank you for sharing that. I think that's a good thought. So definitely noting that, and yeah, it's areas we can kind of consider doing that in various parts of really our entire website, including the tool, how we display information, and balancing when maybe it's best to navigate to another page if a consumer really wants a bigger breakdown versus keeping it simpler on a plan shopping tool like this. So yeah, thanks for that.
Amalia, just on that point, after you select a plan, there is a scale on that last page, which allows a consumer to select how much they want to accept of the tax credit. So it kind of gives them another opportunity to go over that information once they already decided which plan they wanted.
Yeah. So additional to Lou's point, obviously there's more of a breakdown in the actual application when you're applying. And we'll consider that as we're thinking about how we might want to adjust the language on this page. Thanks for the input from everyone on that. Was there another hand raised? I thought I saw one, but maybe it was
Yeah,
put down.
Amelia, I raised it. Lisa Barrows from Care First. So one of the things that I was thinking, potentially, if you do end up building a separate page to lay out details a bit more thoroughly, being able to provide some example scenarios to really allow for the users to kind of get a glimpse into what each type of scenario would look like from their perspective, right? If they decide that they want to use all of their tax credits, this is what scenario A looks like. If they decide to use half, this is how, they may be affected, but just kind of give them an opportunity to think a little bit more proactively in that sense, just from having that understanding.
Thanks, Lisa. Yeah, that's a great thought too. That might be a good segue, unless there's any other kind of burning thoughts that people want to provide before we move on. I will go ahead and navigate to the actual plan shopping page. So we'll click browse. We talked about this page a little bit, and we can certainly revisit this as well. The healthcare utilization page. We can definitely revisit that at either the next meeting or the one after. But for now, we're going to go ahead and skip to the actual plan shopping page. So once we've input all that information, the consumer gets here. Every time a consumer gets to this page, it starts with this disclaimer that gives some information about the importance of checking if a provider is actually covered by a plan, not necessarily just using the plan shopping page, which may show a provider listed under a plan, not relying on that, making sure you're checking that your healthcare provider is covered once you get to the point where you choose a plan. A little more information, and then it gives some information about the metal level descriptions too. So giving that kind of baseline explanation of the differences between the different metal levels, bronze, silver, and gold, premium cost versus cost sharing. So this disclaimer always shows up for consumers, and then they end up on the actual plan shopping page, which is the list of all plans that are available to that consumer. So here, based on the inputs that I gave, there's 42 matching plans, and they can kind of go through the list. We get up to the top here. So currently it's, we can't see the drop down when I click on it, but we have our sorting feature. So we're currently auto sorted by estimated monthly premium. So plans are sorted by premium costs. The premium costs include the net cost of the premium, factoring in any tax credit or state premium assistance that this person's available for. And then you can also sort by, I know you guys can't see it, but annual deductible, annual out-of-pocket maximum. You can sort by health insurance company. You can sort by metal level, total yearly cost. So those are the main sorting features. And then when we click down here, we have our main filter feature. So you can also filter plans by metal level, plan type, HMO, PPO. You can filter by keeping your deductible in a certain range, your monthly premium in a certain range, et cetera. And you can also filter to only show value plans, which are our standardized plans on the exchange that we talked a little bit about at an earlier meeting. So just a quick overview of the filter options, but wanted to kind of scroll down and take a little bit of a deeper dive into our actual plan tile displays. So here's the first plan that's listed on this page. It's an Aetna bronze plan. All of our plan tile displays are the same. So the information that are displayed on each one will be the same regardless of the plan. So we'll just kind of go back up to the first one, using this as our example for our discussion. I'll give everyone a minute to sort of look through it and open it up to just a general, discussion on initial feedback. My main question would be to start, what jumps out when you look at this plan tile display as consumer friendly or working well in terms of, you know, how we're displaying the information we've chosen to put for each plan. So just want to really open it up broadly if anyone has any initial thoughts that they want to bring to the group or dive into a little more. And thinking through too, like, you know, we're talking about how much information is too much information. Is it displayed in a consumer friendly way? Would the average consumer understand the information that they're presented with that we're looking at right now? Thinking through the use of colors, symbols, ways that make translating information much more digestible. So again, I'll open it up for a discussion.
This is Lisa. My big concern has always been, as a navigator and assisting consumers with their insurance enrollment, the button down at the bottom, the find a healthcare provider, and the drug search. And now, when Kristen was talking about the Washington State site, and she was saying that it was a separate orbit that was kind of updating the provider directory, and that would be an excellent thing to consider if it can be more real time than what we currently have, because we've had ones where when we type in a specific provider, or if we're looking at who takes our plan, we've had providers that are no longer even with our practice here that show up as currently one of our doctors. So even if it's updated more timely than what it is currently doing, that would be beneficial.
Thanks, Lisa. And I think Nicole on our plan management team is on. Nicole, if that's right, maybe you could kind of speak to this more. My understanding from what we've discussed is our provider directories are updated bi-weekly or bi-monthly. And it's, you know, it's something that's not fully in our control. And so regardless of how updated something is, it's, you know, we would still want to give disclaimers to consumers to make sure that they're checking that their provider is covered under a plan. And maybe that's a consideration for if the group has any thoughts on whether we're displaying those notices to consumers enough in this plan shopping tool. But Nicole, maybe could you speak to that a little more?
Sure. I think definitely one of the things that we definitely want to make sure that we convey to consumers is to always call the provider's office. I think that's something that we can definitely call more attention to in this space. The provider directory files are sent to us from providers every 14 days. And so right now that is the requirement. And it's something that, again, and even in our conversations with our carriers, that even their own carrier provider directory sites that they have that link that are from the carrier site directly have some delay, just because it's difficult to update in real time. It takes some time from the provider's office to get to the, you know, the carrier that they won't be participating anymore. And then, you know, that whole dance between the carrier and the provider about removing them. So that takes some time before they can update and then send us an update. So we try to capture as real time as we can. We've also had some conversations about using like an API call and trying to see if we can have even, you know, faster update on the provider directory. So we are in conversations about that, but for right now, it is every 14 days. And we are getting those provider directory files from all of our carriers every 14 days, like clockwork. They definitely send those updates over.
Thanks, Nicole. Appreciate it. I see Tom's hand is raised, and then Steve after Tom. Tom, if you're speaking, I think you're still on mute.
There we go. There we go. Pressing the wrong microphone key. I'm just curious. This is an HSA eligible plan, and I'm glad for educational purposes we do include after the deductible on the benefits above, but on the ones where we say telehealth, urgent care, and mental health option, we just have 50% co-insurance. Is that just due to size of the space there, or would it actually say after deductible?
No, just really quickly, Amelia. So that will say after deductible. So you will see that, and if there may be some plans here now where you can see that after deductible, but after deductible does show on that telehealth space as well.
Okay, so these are just the telehealth benefits, whether it's a primary care visit or an urgent care or mental health.
Exactly. And just
Thank
to give a bit of background really quickly about adding that telehealth component, we wanted to make sure that if there was any difference in between a telehealth primary visit versus a in-office primary visit, which some of our plans do have that distinction between the two because they are more telehealth or virtual forward plans, and so they are promoting accessing care through a virtual avenue first before you go into a brick and mortar. And sometimes there's a difference between the two, so we've added that space there so consumers can see that they, if there's any variance between those two things.
What if there was a difference between the provider selected for telehealth? How is that, or is that just too much detail?
So yeah, so again, it would depend on like the provider, whether it's a specialty. So that would be a lot of detail to put in, but we usually are seeing the difference just in between the service itself and not with the provider specific. It's not specific to the provider, but the service.
Okay, thank you.
Thanks, Tom. Thanks, Nicole. Steve, did you want to go ahead with a question? Steve, if you were talking, you were on mute. All right. Well, Steve, I'm not sure if we can hear you, but if you are still on and have a question, we'll circle back to you. I see Lisa has a hand raised.
Yeah, I have a question. So I'm looking at the information within the details link and also the plan costs and benefits link. I'm curious if you have any data between which of those are clicked more often than less, because it looks like the details kind of go through some of the same information that the plan costs and benefits link goes through in more detail. And if you actually if you click on the details section and then scroll to the very bottom, again, you see that plan costs and benefits link. So I'm just wondering, could we potentially eliminate, just to again try and condense some of the information in here? Could we maybe just move forward with like a plan details link, and then if they're interested in actually seeing the details in greater depth, they can then select the link that would then open them up to the PDF outlining specific details.
Thanks, Lisa. Yeah. So just to summarize, your kind of perspective is the details link is probably more what consumers are interested in looking through, and the consideration of, just because there's a lot of links at the bottom of this page and there's a lot of information to review, are we highlighting the right the links that maybe we want to direct consumers to the most? And maybe this plan costs and benefits, when you click this link here, it leads to the PDF that Lisa was mentioning, and so maybe embedding this into this details link right here instead of listing it here and just kind of saving some space here. Again, like maybe Nicole, if you're still on and had some thoughts on that, or what's required to be on a plan tile display, but yeah, just considering how to maybe condense information. Does anyone have any thoughts on that?
So if we're talking about the plan costs and benefits link, that goes directly to the SBC that the carriers provide. So we do have to provide a space here for them to be able to link to that. And it needs to be prominent. Not all of the consumers will click on the details link, so they don't always click that. And so they may not always see that SBC if we place it in that detail space. So we have to have a prominent space here on the plan tile to be able to get to that link, regardless of whether they click the details or not. So it's a difference between the two and why we have it here.
Thank you, Nicole. That's helpful. Steve, I see you're on. Are you able to unmute? Oh, I think Steve just dropped off again. Any final thoughts? We're kind of, yeah, we're at time. If someone has any kind of concluding thoughts, I think what we'll do for the next meeting, we're not going to have any presentations. It will not be presentation heavy next meeting, so we can jump back into this discussion, picking up on this part, the planned tile display, and having a more bolstered discussion about this, and then also getting into the filter and sorting options and thinking through how consumers use these different tools on the plan shopping page, if we can make any kind of improvements there. So we'll be getting more into that discussion at the next meeting. I think we should leave it here for today. Shlomo, did you have a question or comment?
Yeah, it's kind of a question that, again, we could follow up next week on, or in 2 weeks. But just in terms of like helping the clients once they select a plan, I know a lot of the companies like United Healthcare uses a Jarvis platform where brokers are able to go inside and advocate for the consumer if there's any issues or if there's questions on the subsidy or plan enrollment. Aetna has a similar concept with Producer World. Maybe this is more of a question for Lisa Barrows, but Care First, from what I know of, like it's very challenging for the brokers to assist when there are complications or errors or disputes between the exchange and the applicants' enrollment. Is there any way that, we could advocate for a change?
Yeah, no, I know so there have been conversations internally kind of discussing the same idea. So we do have some ideas, I think, in the pipeline, but I want to kind of withhold that, but we do have some ideas in mind. So hopefully we can help with that moving forward.
Thanks for the question. That might be outside the work group, but if we want to connect offline or, do some more direct connections, feel free to follow up with me afterwards. It's a good question. And I'm not sure if Steve is on the line. I know he's been dropping in and out, but I know your hand was raised as well. So one more opportunity, Steve, if you have a question or comment before we wrap up.
Sure. Yeah. Sorry about that. I got getting kicked out. Going back to the provider network discussion, I totally agree with the issues with the timings and the providers providing updates to the carriers. One other aspect that not sure your team has dealt with, the Lee Orbit team, how are you cleaning up your provider list? Just because on the marketplace, there's an issue with carriers where everyone submits carrier or provider names differently, right? So like, for example, one carrier might submit a hospital as St. John Hospital, fully spelled out Saint, while another provider or another carrier will spell it out just St. John Hospital. And so when that happens and a user enters that naming convention into one of these provider search tools, it'll actually show the carrier out of network if they haven't spelled it exactly the same way. So curious if there's any cleanup that your team has been taking a look at least on the Maryland side. I know on the marketplace side, it's very difficult, but has that been a problem at all for your team?
That's a great question. And I am going to save that for next meeting, but I know we've had internal discussions about that. So using our provider directory, if it's case sensitive and everything Steve was getting to, and that can pose some issues when people are using it. So I know we've talked about this before, so I'll make sure that we provide a little more information about what we've been thinking through, and maybe we could talk through it a little more at the next meeting, but thank you for raising that, Steve. It's a great point. So I will go ahead and stop sharing. What we'll plan on doing next meeting is picking up where we left off on this discussion. It'll just be an hour-long kind of discussion focused on what we've been talking about with the plan tile display. We'll have some more questions that we can pose to get at some kind of particulars about what we're thinking about with plan tile and improvements. I can can just share my slides real quick. So I will share all these slides after the meeting in a moment. I'll follow up too about getting everyone's feedback. If you have any thoughts on language for the explaining the tax credits on the estimate of financial assistance page. So I'll provide a little follow-up either later today or by tomorrow after this meeting. The slides include some examples from other states and how they display their plan information, their sorting, filtering options, so that there will be some information in the slides on this, and we can always review it more next meeting. So this is the fourth meeting. Fifth meeting will be in 2 weeks. We'll reconvene the following Wednesday, October 2nd, so beginning of October, same time, 12:30. Again, we'll pick up on this discussion. And we'll try to incorporate as much of the talking points that we want to get through in terms of, getting through plan information, sorting, filtering options, thinking about tailored plan recommendations from the presentation earlier today from Washington. We'll squeeze in as much as we can. We're getting close to the end, so we're going to start putting together draft recommendations based on these work group discussions. So I will start having some of that ready to share with the group, hopefully by next meeting, so we can start thinking through consensus about ideas that have been presented during these discussions. So again, next meeting is 2 Wednesdays from now, October 2nd, same time at 12:30. I'll make sure to send some reminders out. But otherwise, thanks everyone for joining. Thanks for the discussion today, and we'll pick up again in 2 weeks. Thanks, everyone.
Thank you.
Thanks.
Thank you. Bye. All right. Thank you. Bye-bye.